NHA Phlebotomy Exam Prep. Question 1. Why is it important to record collection time? Option A, legal documentation and accurate test interpretation. Option B, for billing only. Option C, to track phlebotomist performance. Option D, not important. The correct answer is option A, legal documentation and accurate test interpretation. Collection time is critical for timed tests, for example, therapeutic drug monitoring, glucose tolerance, tracking specimen viability, legal chain of custody, and accurate clinical interpretation. It is a mandatory documentation element under most accreditation standards. Question 2. The phlebotomist should collect a specimen for glucose analysis. Option A, after eating. Option B, with no fasting. Option C, according to physician order. Option D, always in the evening. The correct answer is option C, according to physician order. Glucose specimen collection should always follow the physician's order, which may specify fasting, random, 2-hour postprandial, or timed draws. No blanket rule applies. Collecting without following the order can lead to clinically misleading results. Question 3. Reflux of anticoagulant into a patient's vein may cause. Option A, hematoma. Option B, infection. Option C, tissue necrosis. Option D, vision loss. The correct answer is option A, hematoma. Anticoagulant reflux can cause adverse reactions including hematoma formation and, in rare cases, systemic complications. To prevent reflux, the patient's arm should be kept in a downward position and tubes should be filled from the bottom up during collection. Question 4. How should phlebotomists handle broken glass or sharps? Option A, throw in regular trash. Option B, place in sharps container. Option C, place in biohazard bag. Option D, rinse in sink. The correct answer is option B, place in sharps container. All sharps, including needles, broken glass, and lancets must be placed immediately into a puncture-resistant, leak-proof sharps container. Placing sharps in regular trash or biohazard bags exposes downstream handlers to injury and violates OSHA regulations. Question 5. A phlebotomist notices petechiae on a patient's arm. This may indicate: option A, abnormal finding. Option B, fragile capillaries or platelet disorder. Option C, allergic reaction to tourniquet. Option D, dehydration. The correct answer is option B, fragile capillaries or platelet disorder. Petechiae, small pinpoint hemorrhages under the skin, indicate capillary fragility, thrombocytopenia, or platelet dysfunction. They can also appear when a tourniquet is applied too tightly or for too long. The finding must be documented and the phlebotomist should proceed with caution. Question 6. Which of the following can cause hemoconcentration? Option A, leaving tourniquet on too long. Option B, using large needle. Option C, proper tube mixing. Option D, site cleansing. The correct answer is option A, leaving tourniquet on too long. Prolonged tourniquet application, 60 seconds, causes venous stasis and fluid shift from plasma into tissues, concentrating blood components such as proteins, RBCs, and certain analytes, a phenomenon called hemoconcentration that falsely elevates results. Question 7. Labeling specimens should be done. Option A, before collection. Option B, while patient waits in reception. Option C, at the patient's side after collection. Option D, at the end of the day. The correct answer is option C, at the patient's side after collection. Specimens must be labeled immediately at the patient's bedside after collection while the phlebotomist can directly verify patient identity. Pre-labeling or delayed labeling significantly increases the risk of mislabeling and patient safety errors. Question 8. Airborne pathogens require what level of precaution? Option A, contact. Option B, droplet. Option C, airborne isolation. Option D, standard only. The correct answer is option C, airborne isolation. Airborne isolation precautions are required for pathogens like Mycobacterium tuberculosis, measles, and varicella that are transmitted via small particle aerosols. This requires N95 respirators and negative pressure isolation rooms, a higher level than droplet or standard precautions. Question 9. The term phlebotomy literally means: option of vein incision, option B artery puncture, option C skin puncture, option D blood transfusion. The correct answer is option A, vein incision. Phlebotomy derives from the Greek phlebo, vein, and tomi, incision or cutting, literally meaning the incision of a vein. While modern phlebotomy uses needles rather than actual incision, the term remains the standard descriptor for blood collection procedures. Question 10. How should specimens be transported to the laboratory? Option of labeled and protected according to type. Option B, in any container. Option C, without labels. Option D, at room temperature always. The correct answer is option A, labeled and protected according to type. Specimens must be transported labeled, in appropriate closed containers, and under conditions specific to the test, for example, chilled for ammonia and lactate, protected from light for bilirubin, at room temperature for most routine chemistry. Incorrect transport conditions compromise result accuracy. Question 11. A light mix specimen may cause which of the following? Option A, fatty plasma. Option B, hemolysis. Option C, icterus. Option D, clotting. The correct answer is option A, fatty plasma. Light-MIA produces a milky, turbid plasma appearance due to elevated triglycerides and chylomicrons, often described as fatty plasma. This is distinct from icterus, elevated bilirubin causing yellow discoloration, and hemolysis, red discoloration from ruptured RBCs. Question 12. The additive in a serum separator tube is: option A, EDTA, option B, heparin, option C, clot activator, option D, citrate. The correct answer is option C, clot activator. Serum separator tubes, SSD/gold top, contain a clot activator, thrombin or silica particles, that accelerates clot formation, along with a gel that separates serum from cells after centrifugation. They do not contain anticoagulants like EDTA or heparin. Question 13. Which of the following is most important to prevent infection? Option A, proper PPE and hand hygiene. Option B, fast collection. Option C, using large needles. Option D, shaking tubes vigorously. The correct answer is option A, proper PPE and hand hygiene. Hand hygiene and appropriate PPE use are the foundational infection control measures in phlebotomy. They interrupt pathogen transmission between patient and practitioner and are required by OSHA and standard precautions guidelines regardless of procedure type. Question 14. Which of the following stops blood clotting by inhibiting thrombin? Option A, oxalate. Option B, EDTA. Option C, heparin. Option D, citrate. The correct answer is option C, heparin. Heparin inhibits coagulation by potentiating antithrombin 3, which inactivates thrombin and factors A. This distinguishes it from EDTA and citrate, which both work by chelating calcium, and from oxalate, which also chelates calcium but is rarely used in modern practice. Question 15. Which is the safest way to remove needle after venipuncture? Option of recap using one-hand technique. Option B, pull and shake. Option C, recap two-hand technique. Option D, leave in patient. The correct answer is option A, recap using one-hand technique. If recapping is necessary, the one-hand scoop technique minimizes needle stick risk by keeping the free hand away from the needle path. However, best practice is to activate the safety mechanism and dispose directly into a sharps container without recapping at all. Question 16. A blood smear is primarily used in: option A, coagulation tests. Option B, CBC differential. Option C, chemistry profiles. Option D, urinalysis. The correct answer is option B, CBC differential. Blood smears are examined microscopically as part of the CBC differential to assess RBC morphology, WBC types and morphology, and platelet estimates. They are essential for diagnosing conditions like malaria, leukemia, and sickle cell disease. Question 17. Which of the following terms refers to the study of blood? Option A, hematology. Option B, microbiology. Option C, immunology. Option D, radiology. The correct answer is option A, hematology. Hematology is the branch of medicine and laboratory science dedicated to the study of blood, blood-forming tissues, and blood disorders. Microbiology pertains to microorganisms, while immunology focuses on the immune system. Question 18. The abbreviation STAT means: option A, standard time. Option B, immediately. Option C, soon after tomorrow. Option D, scheduled test. The correct answer is option B, immediately. Stat is derived from the Latin statim, meaning immediately. Stat orders require specimen collection and processing with the highest priority, typically within 30 to 60 minutes, and are designated for critically ill or time-sensitive clinical situations. Question 19. The first step after identifying the patient is to: option A, apply tourniquet. Option B, wash hands. Option C, prepare equipment. Option D, ask for allergy history. The correct answer is option B, wash hands. After patient identification, hand hygiene must be performed before any patient contact or equipment preparation. This sequence prevents pathogen transmission and complies with infection control standards. Skipping hand hygiene is a significant safety violation. Question 20. A blood culture should be collected in an order before: option A, EDTA tubes. Option B, serum tubes. Option C, heparin tubes. Option D, glucose tubes. The correct answer is option A, EDTA tubes. Blood cultures must be collected first in the order of draw to minimize the risk of contamination from skin organisms and to prevent carryover of additives from other tubes. EDTA, heparin, and other additive tubes follow after blood cultures.